Hi, in today's video we're going to talk about how to contract your core and some of the principles around it. So first of all, when we think about contracting your core, if you haven't already watched the video on how to kegel, then you should go back and watch that, because that is the basis of how we begin a contraction of our deep core muscles. The first thing I want you to do is think about visualizing the muscles that we're trying to contract. So remember our deep core here. We've got the spine at the back, we've got our diaphragm at the top, pelvic floor at the bottom, and then we've got our muscles which wrap around from the spine, around the abdomen and to the back. So remember, we're thinking of that as a canister, of your core canister. And the main muscle that we're trying to contract as our primary core muscle is our transverse abdominis. So this muscle wraps around and protects our spine, which if you've watched the previous videos, you should already know this. You're influenced by certain factors on how well you contract your core. The first one, in no particular order, first one would be your breathing. So we always want to contract our core on an exhale. You can move into a brace, but your initial core contraction would be on an exhalation. And again, referring back to the Kegel video, always done on an exhalation, and that is the basis of how you begin a core contraction. The second influence that would factor how well, or if you're even able to contract your core correctly, is your postural alignment. So if you're sitting with a slumped stomach like this, it might be quite difficult for you to contract your core versus if you were sitting up straight in proper alignment here, because all of our muscles need to connect to one another, and it's also going to impact your respiratory system and how well you can breathe, so how well you can set up your initial core contraction. When you're contracting your core, you need to think about certain things. So first one is visualizing the muscle. So remember that transverse abdominal muscle wraps around here like a corset, and the fibers run this way. Then you have your rectus abdominis on the top, and those fibers run this way. And then you have your internal and your external obliques, which run diagonally or obliquely. So we're going to start by inhaling. And when you inhale through the nose, feel your breath go all the way down to the bottom of your pelvic floor. And then as we exhale, we're going to begin with a kegel. I'm not going to teach you how to kegel because that's in the previous video. And then we're going to, after our kegel has come up, we're going to contract our transverse abdominals, or our corset muscle. So remembering that muscle runs this way horizontally, and it can cinch and shrink in your waist. If we contract this muscle before the pelvic floor, all we're doing is squeezing and pushing pressure downwards. So what we want to do is inhale through the nose. On your exhalation, kegel and lift the pelvic floor. Then contract your transverse abdominals, visualizing it like a corset being done up from the bottom up. Feel that shrinkage come in. And the more you exhale, the more you should feel that shrinking underneath your hands. If you're sitting upright and you're finding it difficult, then you can lie down on the floor, which instantly reduces the pressure inside your abdomen and therefore makes it easier. So again, hands on your transverse abdominals so you can feel what's happening. I like to put my thumb in the waistline and then have your hands wrapped around the front so you can really feel what's happening, give your brain that feedback of what's happening inside your body. So two key things: you want to visualize it. You want to visualize the muscle by thinking about it and thinking what's happening. And you can also use a mirror to literally visualize what's happening from the outside of your own body. And then the second thing is you want to feel it. You want to feel it by touching, because that's going to give your brain that feedback. You also want to feel it by internally feeling what you can feel happening within your body. So all of those components will give your body feedback so that your connection between your brain and your muscles strengthens. So your neural connection will, or your mind to muscle connection will start to strengthen. So let's set our hands up. Breathing in, feel your breath go all the way down to the pelvic floor. And then exhale through the mouth. Kegel, lift your pelvic floor up. And then try to zip up your corset muscle from the bottom upwards. Keep exhaling. Use your hands as feedback, and you should feel some shrinkage happening underneath your fingers. Your abdomen should become more tense, and your pelvic floor should feel like it's lifted up. Then you're going to inhale, relax, let it go. Feel the change underneath your hands. As you breathe in, your belly should rise and those muscles will start to relax. And then again, on your exhale, kegel your pelvic floor up. Use a nice long audible exhale through your mouth. Our vocal cords are connected to our pelvic floor, so that is going to help us lift the pelvic floor and contract our muscles even more so. It's also going to help stabilize the pressure, which we'll talk about in a minute. Once you've done that, you should feel the shrinkage, you should feel the tension underneath your fingers. Inhale, relax, and let it go. We're going to keep doing this until you feel like you've got it. So if you don't feel the shrinkage, or if you feel pressure coming up against your abdomen like this, or if you can see it, then that's not a good sign. Obviously your muscles are not contracting if everything is pushing up, because when our muscles contract, they should be compressing our abdomen inwards towards our spine. So then you've got to troubleshoot, what am I doing wrong? Generally it comes back to the breathing mechanics, or it's just the technique of how you're doing it. Sometimes you're trying to push down, you know, like you're trying to push a baby out. You're trying to push down from the top down, and that's going to create a pressure pocket here. You can see that bulge because I'm pushing down. What we want to do is lift up from the bottom and use your exhalation. So you inhale, exhale, lift the pelvic floor. And this shrinkage should start to happen naturally. If you have your breathing mechanics right, if you're lifting your pelvic floor properly, this is the next thing that should instinctively happen. You're trying to keep your upper abdominals relaxed, so we're not squeezing and bulging and pushing down. Your chest and your upper body should be completely relaxed also. Once you've got that, then we can start to think about the other core muscles here and how to contract those. So that's how to contract your pelvic floor and your transverse abdominals. What if you wanted to also contract your rectus abdominis, or your muscles that are on that top layer? If you, again, don't contract your pelvic floor or your transverse abdominals, and then you try to contract your rectus abdominis, or that layer on the top, you're not going to create a nice flat stomach. Your stomach's going to look probably out of shape, and you're also going to be having pressure downwards on your pelvic floor, which is also not a good thing. So coming back to the function of the core and why we even contract it in the first place, we have our spine here, you've got your trunk, and then you've got your lower body, and then we're connected by this midsection here. When we contract our core, a few things happen. One, we're obviously contracting the muscles, so we're creating stability from the trunk to the lower body so that they can be more connected. You can create more power, and of course you're protecting yourself from injury. But we're also creating stability for our spine. So without that stability created by compression of the muscles, our spine, if we didn't have that, our spine is open to injury. All those little discs between there, they're just going to be super loose and floppy, and you're going to be injured. It's going to happen, absolutely. The other thing that will happen is we're stabilizing our intra-abdominal pressure. So if you haven't watched previous videos, you won't know too much about what I'm talking about there, but go back and watch those and then come back and this will make sense. So when we're contracting our core muscles correctly, pelvic floor, transverse abdominals, and then the other core muscles there, we're creating that stability. So that's going to, with our canister, contain that pressure inside our abdomen evenly so that we don't have pressure pushing out on different areas within the torso. So for example, we don't have pressure pushing out against our linea alba or our connective tissue, which is not going to help heal a diastasis recti, and it's also going to help create one if you didn't have one in the first place, if you do those movements repetitively. And therefore, no, you're not going to get a nice flat toned stomach if you can't control your core contraction and manage your intra-abdominal pressure correctly. So if we want to then think about, if you're nailing this and you want to think about contracting your obliques or your rectus abdominis, let's go through, and let's do the obliques first. So we'll take a side plank position. And remember, if our transverse abdominals and our pelvic floor are not working yet from here, you haven't nailed that, there's no point you continuing, because you're just going to create or encourage further dysfunction within the body. So just pause it, go back and come back to this another day once you feel like you've mastered the basics. So we'll take a side plank position here. Again, we're going to inhale, feel our breath go down to the pelvic floor. As we exhale, we begin by a kegel. Lift the pelvic floor up and then contract your transverse abdominals on. Then you can lift up off the floor. If you lift up too early, you're going to find that your abdomen is going to become a funny shape, because you're not managing your pressure and you're not able to get those muscles on correctly to create that shrinkage and that stabilization for your spine. So from here, inhale, exhale, kegel, wrap your transverse abdominals in, and then exhale and push up. Think about pushing up from underneath your side here as you lift up. And then if you look down at your abdomen, you'll know if you have contracted your core correctly, because if you feel under here, you've got tension under here. You can feel that these oblique muscles are tight. These ones up here, because we're in the side plank position, will be relaxed, and therefore these muscles are obviously contracting. Then trace your hand up and down your tummy. Do you feel that your pelvic floor is lifted? Can you feel that internally by thinking about it? Is your abdomen flat, or do you have some sort of bulging shape, which would usually be down on this lower portion of your tummy? If so, then you haven't contracted your transverse abdominals correctly. The other thing that can influence how you contract your core is just whether you have enough strength and connection between your mind and your muscles. And if you don't, then you've just got to regress and go back to the basics and just work on that until you get stronger. So again, feeling it. Could you feel a funny shape? Was it nice and flat? What muscles could you feel contracting? And then visually, could you see it? Did you see a funny shape? And what did you feel internally when you could visualize the muscle groups? Could you feel them coming on and moving and contracting? If so, then that's great. You know how to contract your obliques correctly. That's just one way. Of course, we've got another way to contract your obliques, where you're leaning over for a side bend, for example, and then if you were to contract to come back to the middle, it's the same principle. So from this position here, your oblique muscles are stretched out. To get back to the center, by contracting your obliques, you want to again initiate with a kegel, wrap your transverse abdominals together, and then shorten these muscles here. So rather than lifting up from the floor, you're thinking about shortening those muscles that are lengthened. At the top here, your pelvic floor should be lifted, transverse abdominals are on, these muscles are contracted, and everything in here should feel like it's flat. There's no pressure pockets bulging out, and you should be able to visually see that in your mirror as well. So leaning over, inhaling, exhale. If you just move your arms, you can get your trunk up, but you're not connecting through the core. So make sure you can feel what's happening underneath there. Get the connection between your brain and your muscles stronger. So even if you had no hands to touch, you would be able to feel and know exactly what's happening within your trunk. Again, if you've mastered that, then we're going to move on to how to add on a contraction of your rectus abdominis. So let's take a plank position. And again, remember, everything has to be in synchronicity. So pelvic floor first on the exhale, transverse abdominals come in, your obliques and then your rectus abdominals can come on secondary to that. And then that's going to create a whole lot of stabilized pressure within the trunk. So you'll feel that tightness and you'll feel that compression. Your spine should not feel, or your back should not feel any pain, because your spine should be nice and safe with that tightened little cocoon that you've created by your contracted core. So we'll take a plank position down on the elbows and the knees. Before you lift up into your plank, you want to set your deep core contraction up. So before you lift your legs off the floor, kegel your pelvic floor up, get your transverse abdominals wrapped together tightly, get your corset, so that's your corset. Your transverse abdominals are like a corset. Get your corset on tight. Once you feel that your core sits on tight, then you can contract and flex your rectus abdominals. Remember, the muscle fibers run this way, so you're trying to shorten them together to contract them, because that's what a contraction is, right? You're shortening the lengthened muscle. So if you do that correctly, you can't feel with your hands for feedback here, but you would be able to see if you had a mirror or something nearby. But this is where your mind to muscle connection really comes into play. So you should feel that compression and that tightness once you go up. And if you feel something pushing down on your pelvic floor, or if you feel like you've got something doming out or pushing out of your abdomen, or you feel any pain in your back, then those are all signs that either the exercise is too advanced for you, or you're just not contracting your core correctly. So with a plank on your feet, it is quite an advanced exercise if that's too much for you, or if you have prolapse, if you have diastasis recti, if you are pregnant, then you should elevate your surface, so you can do that off a bench or even off the side of a wall. Have your elbows on a wall to reduce the intensity of the exercise, which therefore reduces the amount of intra-abdominal pressure that we are creating, and therefore makes it safer for you. It does make the exercise a little bit easier, but remember, if you're not doing it right, there's no point in doing it at all. So if you need to regress that, do so. So again, down on the elbows, knees are on the floor. We're going to set up our deep core contraction first before we go up onto our feet. So inhale, exhale, contract your pelvic floor up, transverse abdominals in, and then you can straighten your legs, and then you can think about shortening your rectus abdominis. So it will look like this. Once you're up in your plank position, you have shortened the rectus abdominis, but now we can take it to the next level. So we've had our pelvis in a neutral position. When we lift our pelvic floor, contract our transverse abdominals, and we go up into our plank. If we want to take our rectus abdominis contraction to the next level, because now we've got everything else on safely, we can. So we've tightened the muscle, but we're still in neutral. So from here, if you think about flexing your lower abdominals up, so posteriorly tilting the pelvis, flexing your upper abdominals down, bring your rib cage down to your belly, and then draw your belly button up to your spine. So you will have a curved back. Now you've got maximal contraction of your rectus abdominis. Everything underneath was already contracted, so then you're safe to add that little bit of extra oomph into your plank. Again, if you feel any funny shapes, you feel any pain, then that's highlighting either an issue with something structural within your body, or the fact that you're just not contracting your core correctly, or the exercise is just too advanced for you. So those are all quite simple core patterns. In the next video, I think I might go through some advanced breathing patterns and advanced core movement, so how to use your breath with a more advanced movement in order to maximize what you're getting through your core. Hope this video was helpful to someone, and I will see you in the next one.